Hello everyone, I am Dr. Simone Atkinson, and in today's lecture we are going to continue on with mastering some of the most frequently tested drugs on NCLEX. And this is part 2 of a two-part series, learning drugs with prefixes and suffixes. And we will continue to discuss some common medication beginnings and endings with the names to help remember some major classes and the commonalities that will help you speed up your study time. So let's get to the point of these antifungals, psych meds, and everything in between. So the first drug class we will cover are the antifungals. The antifungals end in azole, A-Z-O-L-E, and they're a little bit weird because not all drugs that end in azole are antifungals, and we'll see that a little bit later. And then there are others that don't end in azole, but they're relatively easy to spot, like the fungin. So like micafungin, you just have to know that the fungin refers to it being an antifungal. Now, one that's not so easy to spot is the amphotericin B. That one you just have to know. And the way that I remember that is I just remember amphoterrible antifungal amphotericin B. So the amphoterrible antifungal amphotericin, that is really bad for the kidneys. And you just have to remember that it's an antifungal. Now, if you are giving amphotericin, you do want to hydrate your client with IV fluids 2 hours before and 2 hours after, because that will help to decrease nephrotoxicity. If you're giving a client an antifungal that is topical, you want to make sure that you are wearing latex gloves when you're applying it to the skin so that you don't get it onto your own fingers. And you want to apply it sparingly. You don't want to over apply too much, as well as you don't want to put an occlusive dressing over it to cause it to get warm. And you should advise the client to also avoid wearing restrictive clothing. So antivirals, almost all of them end in vir, V-I-R, for viral. And there are a lot of them that don't end in vir, but the vir ones are the high yield ones that are most often tested. So those are the ones you should definitely be able to recognize. They're usually taken for one of two reasons, whether it's herpes or shingles. And there is a rare side effect that can happen that you may see a test question on, where it causes crystalline neuropathy, where it builds up in the kidneys. So make sure to give it slow IV push, and we want to monitor the client's urine output. For client education, remind them that when they have the infection, they should be avoiding sexual intercourse, avoid touching the lesions, and for women, they should have a Pap test because they're at increased risk of cervical cancer with the genital herpes. There's another class of antivirals called protease inhibitors, and they don't end just in vir, but they end in navir, N-A-V-I-R. So these are also easy to recognize as antivirals, and they are usually used for clients with HIV and AIDS. Now let's look at some psych medications. Here we have selective serotonin reuptake inhibitors, or SSRIs, and the two older ones end in cetine, X-E-T-I-N-E. A few examples, or the two examples, are fluoxetine and paroxetine, but these are the older meds. And now we have the newer ones that include sertraline, citalopram, and escitalopram. And sertraline is frequently tested. So some good questions that focus on SSRIs is that they take a while to start taking effect, up to 4 to 6 weeks at times. So someone, if they're complaining that the medication is not working, you need to tell them that it can take up to 4 to 6 weeks actually to take effect. So you don't want to switch the medication too quickly. Now, serotonin syndrome is also a possible issue. So we don't want to administer SSRIs with MAOIs because that would cause serotonin syndrome. You have to have a break of at least 14 days with coming off of one before you would actually start the other. And you never want to give both together. So often we see questions, though, about suicide in the early part of the treatment with SSRIs. When the client starts feeling better and they have an increased energy, they're at risk of suicide because they have this new energy that they didn't have before, and just the right amount of energy to be able to actually kill themselves. So you do want to be monitoring for that, and ask the client if they're having suicidal thoughts, and are they planning to carry it out if they do have suicidal thoughts, so that you can intervene early. So SSRIs also have a decreased libido effect for the client. And we also want to monitor their CBCs for decreased red blood cells, white blood cells, and platelets, and we need to monitor their bleeding time. Now we have the benzodiazepines, PAM and LAM. So there are a large variety of them. So most end in Z-PAM and Zolam. So given for anxiety, seizures, to induce anesthesia, to help clients sleep. So what's the most common theme here is that they all cause central nervous system effects and respiratory depression. So we need to worry about respiratory depression, and we have to know the reversal agent for the benzodiazepines, which is flumazenil. So remember, there's a high risk with addiction with benzodiazepines as well as possible overdoses. So it's extremely important that you do remember that flumazenil is the reversal agent. Sometimes it can take from 30 to 60 minutes to start working. And once they do, patients may become dizzy and agitated and confused because you have just reversed them from their overdose. So please be on the lookout for any patient that is on a benzodiazepine for their dependence and possible overdose, and know that flumazenil is the reversal agent. Now we'll just look at a collection of some other drugs that are just the in-betweens from antifungals to psych medications that are also important to review. So we'll start with the sulfur-containing medications. So there are several different sulfur drugs that are used, but what's most important is that you want to be on the lookout for sulfur allergies. So how do you identify these? Well, they have SULF or sulf in the beginning of the name. So some that are common for UTIs, you can see sulfadiazine, you have an anti-diabetic sulfonylurea, and these are used for different reasons, but what's most important is sulfur allergies. And you want your clients to drink lots of fluids. You want them to avoid any alkalizing agents and not to take them with milk, fruit juice, or sodium bicarb. And the sulfur drugs are also photosensitive, so we want the clients to use sunscreen and stay out of sunlight. Now we have the HMC-CoA reductase inhibitors, which are your statins. They end in S-T-A-T-I-N, statin, such as atorvastatin, lovastatin, pravastatin. And what's important to look out for these medications are your LFTs, your liver function tests. The other thing is clients often complain of muscle pain. So watch out for liver problems and be careful for and monitor for muscle pains in clients taking statins. Now we have the proton pump inhibitors, the PPIs, which are the prazols. So remember when we talked about the azoles, which were the antifungals, we don't want to confuse them with the prazols, which are the proton pump inhibitors. So you can see we have omeprazole, pantoprazole, for example, that are the proton pump inhibitors. One that's in here that you need to remember that we went over is aripiprazole, which is an atypical antipsychotic. It ends in prazole, but it is not a proton pump inhibitor. That is the atypical antipsychotic that we reviewed earlier. So what's important is that they reduce acid in the client's stomach, and they actually work better than the H2 receptor blockers that we will cover next. But the most important thing to remember is that they reduce acid. And finally, we have the H2 receptor blockers that are the tadines or tadine, such as cimetidine, ranitidine, famotidine. And these are the H2 receptor blockers. They don't work as well as the proton pump inhibitors, but they also help to reduce and keep acid down. So just remember the tadines, T-I-D-I-N-E, cimetidine are the H2 receptor blockers. So if you found this information helpful, please do us a favor, like and subscribe to the channel. It doesn't cost you anything but a click of the button to share your gratitude. This brings us to the end of the prefix and suffix medications. The next video will be more comprehensive and include practice questions. So please be on the lookout for part 1 of the next video that will include questions, and we will be doing several series to help you study your medications for NCLEX.